Welcome to another deep dive. This time we're going to tackle teaching and counseling and nursing.
Yeah.
Two things that can really make a difference for your patients. And honestly, probably your stress level too.
Oh, absolutely. And it's interesting because we often think about the hands-on part of nursing,
Yeah.
but so much of it is actually about teaching and helping patients.
Really helping them understand how to manage their own health.
Exactly.
Yeah. And I think that's becoming even more important now
Mm-hmm.
with the way healthcare is changing.
Yeah.
With shorter hospital stays
Yeah.
and more people going home and having to manage things themselves.
Right.
It's like I was reading something about this, and one quote really jumped out.
Okay.
It said, current trends in healthcare are making it essential that patients are prepared to assume responsibility for self-care management.
That's a really good point.
Isn't that wild?
It is, because think about it. Patients are being sent home sooner and sicker than ever before.
Yeah. And if they don't understand
Right.
what they need to do, that
Yeah.
can lead to all sorts of problems.
Absolutely. Like readmissions
Yeah.
or complications.
Oh, for sure. I remember when I was a brand new nursing student
Yeah.
and I had this patient,
Mm-hmm.
and they asked me a question about aspirin therapy and Ray's syndrome.
Okay.
And I had no idea what Ray's syndrome even was.
Oh,
I
gosh.
was like, oh my gosh, I felt so put on the spot.
I think we've all been there.
Right? Like, do I try to sound like I know what I'm talking about?
Right.
Or do I just admit that I have no clue?
Yeah. What did you do?
Well, I took a deep breath
Mm-hmm.
and I told the patient,
Mm.
I'm really sorry, but I need to look into that.
That's great.
And we actually ended up researching it together,
Wow.
which was a really cool learning experience for both of us.
What a great example of honesty and just commitment to learning.
Yeah. Yeah, I felt a lot better about it
Yeah,
than try to fake it.
for sure.
So let's talk a little bit about the different types of teaching and counseling that nurses do.
Oh.
I know from what I've been reading,
Mm-hmm.
it can kind of be broken down into three main areas:
Yeah.
promoting health,
Mm-hmm.
preventing illness,
Right.
and restoring health.
It's a great way to think about the different ways we educate patients.
Yeah, like think about it. You could be teaching new parents about infant care,
Mm-hmm.
right, to promote their baby's health.
Yeah.
Or you could be counseling a patient on quitting smoking
Right.
to prevent illness.
Exactly.
Or explaining a post-operative care plan to help someone recover
Yeah.
from surgery.
It really covers a wide range of situations.
Yeah. Yeah, it's not just about giving instructions, though, right?
No.
There's a real skill to teaching effectively,
Absolutely.
especially when you consider that everyone learns differently.
Right. And thankfully, there are some tools to help nurses with this.
Right.
One that comes to mind is the TEACH acronym,
Oh, yeah.
which stands for 5 Key Principles for Good Patient Teaching.
Okay, let's see if I can remember what TEACH stands for. I know the T is for tailor,
You got it.
as in tailoring your approach to each patient.
It's all about tuning into the patient.
Yeah.
Before you even start teaching,
Okay.
you really need to consider their needs, their learning style.
And their preferences.
Exactly.
Some people are visual learners.
Mm-hmm.
Some people learn better by doing things.
Absolutely.
All right, so T for tailor.
Yep.
What about E?
E is for edit,
Okay.
as in edit the information
Got it.
to make it understandable.
No medical jargon.
Exactly.
Okay. What about A? Is that assess? Like assess their understanding.
It's close. It's act on every teaching moment.
Oh,
Yeah.
okay.
Because even a short conversation
Right.
can be a teaching opportunity.
That's a good reminder. We're always teaching.
We are.
Okay, so C, I'm going to guess confirm understanding.
You're on a roll. It's clarify often.
Okay.
Don't just assume they get it.
Yeah.
Check in, make sure things are clear.
Okay.
Ask questions.
So clarify often.
Yeah.
And H.
H is for honor.
Okay.
Honor the patient as a partner
Yes.
in the education process.
Involve them in the decision making.
Exactly.
Ask about their goals.
Mm-hmm.
Recognize that they're the expert
Absolutely.
in their own lives.
Yeah.
Gosh, thinking back to that situation with the aspirin question.
Uh-huh.
I wish I had known about Teach back then.
Yeah, it's a great tool.
Would have been really helpful.
It would have. And, it's not just about what you teach.
Right.
It's also about how you teach it.
Okay.
You got to think about the patient's age and developmental level.
You wouldn't teach a child the same way you would an adult.
Exactly.
Right.
Kids learn so differently.
I remember learning about Piaget's theory of cognitive development.
Uh-huh.
You know how children's thinking abilities develop in stages?
Right, right. So, like, with a young child,
Yeah.
you might use simple language.
Yeah.
Colorful pictures. Maybe even make it a game.
Yeah, for sure. So meeting them where they are developmentally
Right.
and using techniques that match their learning abilities.
Yeah.
What about adults? How does their learning style differ?
Well, there's a whole field of study called andragogy,
Okay.
which is all about adult learning.
Interesting.
And adults tend to be more self-directed.
Mm-hmm.
They want to know why this information is relevant to them,
Yeah.
and they want to be treated as partners.
Right. We want to feel like we're in control of our own learning.
Exactly.
Exactly.
Makes sense. This makes me think about family caregivers
Mm-hmm.
and how important they are.
So important.
Because so many people are caring for loved ones at home,
Right.
and they often feel overwhelmed and unprepared.
Yeah.
It's a lot to take on.
It is.
You know, I read that an estimated 53 million people in the U.S.
Wow.
provide unpaid care
That's huge.
to a family member.
Yeah.
That's a lot of people.
That's a lot of responsibility. Yeah. So it's really important to include family members
Absolutely.
in the teaching process as much as we can.
Whenever possible.
They need to understand what's going on
Right.
and how to help.
And there's actually a model to help with this
Oh, okay.
called COPE,
Okay.
which stands for Creativity, Optimism, Planning, and Expert Information.
That's great.
Yeah.
It's really about giving them the tools
Right.
and the support
Yes.
they need.
Yeah.
Now, switching gears a little bit,
Yep.
I also came across this idea of health literacy,
Yes.
which I think is really important,
It's so important.
but also awfully overlooked.
It is.
You know, health literacy is basically a person's ability to find, understand, and use health information
Right.
to make good decisions about their care.
To make informed decisions.
Yeah, and unfortunately, a lot of people struggle with this.
Mm-hmm.
It's kind of shocking to think that over a quarter of adults in the U.S.
Wow.
have limited health literacy.
That's a huge number.
That's a huge barrier
Yeah.
to getting good health care.
It is. And it can lead to all sorts of negative outcomes.
Right. Like if you don't understand your medication instructions
Exactly.
or your treatment plan,
Yep.
that can really impact your health.
Absolutely.
So what can nurses do to help with this? I remember reading about a program called Ask Me 3,
Oh, yes.
which seems like a really simple but powerful tool.
And a great program.
And it encourages patients to ask these 3 basic questions.
Uh-huh.
What is my main problem? What do I need to do? And why is it important for me to do this?
I love those questions.
Right? It's so simple,
Yeah.
but it really gets to the core
Mm-hmm.
of making sure patients understand
It empowers us.
what's going on
Yeah.
and why it matters.
Exactly.
I also saw some tips about using clear communication
Oh.
to promote health literacy.
Mm-hmm.
Things like using plain language,
Mm-hmm.
avoiding jargon,
Right.
and using visuals
Yeah.
to help people understand information better.
Absolutely.
There was actually this tool called the newest vital sign,
Oh, yeah.
which I thought was really interesting.
Like a really clever tool.
It uses a nutrition label
Yeah.
from a food
Uh-huh.
to quickly assess a patient's health literacy.
It's a really non-threatening way to do it.
Yeah.
Yeah.
It's just a really clever way to make health information more accessible.
It is.
So we've talked about the importance of clear communication,
Mm-hmm.
but what are some actual techniques that nurses can use when they're teaching patients?
Well, it really starts with being a good listener.
Okay.
You know, make eye contact.
Yeah.
Pay attention to their body language.
Right.
Ask clarifying questions.
So really make sure you're both on the same page.
Exactly.
Yeah. It's about creating that safe space
Mm-hmm.
for them to ask questions and share their concerns
It is.
and feel heard.
Right. And remember, communication goes both ways.
Yeah.
So encourage them to ask questions.
Real.
Have them repeat things back to you.
Yeah.
Even demonstrate skills.
To make sure they really get it.
Exactly.
And of course, we need to remember that not all patients are ready to learn
Right.
at the same pace
That's true.
or in the same way.
Yeah.
So how can we figure out what a patient's learning needs are?
Well, that's where your assessment skills come in.
Okay.
You know, really take the time to get to know your patient.
Mm-hmm.
Understand their background, their health literacy level.
A learning style.
Exactly. Ask them about their experiences,
Okay.
what they already know,
Mhm.
what they're worried about.
It's like gathering all the pieces of the puzzle before you try to put it together.
That's a great way to put it.
Mm.
And remember, motivation is key.
Right. If they're not motivated to learn,
It's going to be much harder.
yeah, it's not going to stick.
Yeah.
This reminds me of something I read about nursing diagnoses
Mm-hmm.
related to patient education.
Yes.
So just like we assess for physical or emotional needs,
Mm-hmm.
we also need to assess for learning needs. And we might come up with diagnoses like knowledge deficit
Right.
or readiness for enhanced knowledge.
Yeah.
So how would a nurse actually use those diagnoses in practice?
Well, once you've identified that learning need,
Okay,
you can then develop a teaching plan
got it.
to address it.
Can you walk us through, like, the steps involved in creating a teaching plan?
Sure. First, you need to set clear goals.
Okay.
What do you want the patient to be able to do
Yeah.
or understand?
By the end of the teaching,
Exactly.
like, be able to show you how to use an inhaler correctly
Right.
or explain the signs of low blood sugar.
Exactly.
Okay, so clear goals.
Then you'll choose your teaching methods.
Okay.
What are you going to use? Demonstrations, discussions, pamphlets, videos.
And you want to think about the patient's learning style when you make those choices.
Absolutely.
Okay, so goals, methods, and then what?
Well, then how do we know if the teaching worked? That's where learner outcomes come in.
Oh, wait, learner outcomes. Those are the specific changes we want to see
Yes.
in the patient's knowledge skills or attitudes.
Right. And they need to be measurable.
Okay,
Of
so
course.
it's not enough to just say the patient will understand diabetes.
Right.
We need to be more specific.
You got it.
Okay, so maybe something like the patient will be able to list 3 signs of high blood sugar.
Perfect.
Or the patient will be able to show you how to check their blood glucose.
Exactly. Much more measurable. And don't forget about the 3 domains of learning.
Oh, right. Cognitive, affective, and psychomotor.
You got it. So when you write those outcomes,
Yeah.
you want to use verbs that match the domain.
Okay, like describe, explain, identify for cognitive outcomes.
Mm-hmm.
Demonstrate, choose value for effective outcomes,
Mm-hmm.
and perform, demonstrate, create for psychomotor outcomes.
Exactly.
Okay, that's helpful.
It is. Now, once we've done the teaching, how do we know if it's stuck?
Right, how do we evaluate whether it was effective?
Oh. Well, that's where evaluation comes in.
Okay.
We need to assess the patient's learning
Hmm.
and also how well we taught them.
So how do we go about doing that?
Well, there are different methods.
Okay,
For knowledge, you might ask them to explain something back to you
right.
or answer some questions.
Okay.
For skills, you could have them demonstrate
Yeah.
or watch them do it.
Okay. And it's also a good idea to ask for their feedback on the teaching itself.
Absolutely. Did they find it helpful? Was it clear?
Right. Like, were there any parts they didn't understand?
Exactly. And remember, evaluation isn't just for the patient.
Right.
It helps us to reflect on our own teaching.
And figure out how we can improve.
Exactly. It's all about continuous improvement.
I feel like we've covered a lot of ground already.
We have.
But there's still so much more to talk about.
There is.
Like documentation, which I know is everyone's favorite topic.
Right.
And then, of course, there's the whole area of counseling.
Yes.
So much to explore.
Absolutely. Okay, so let's talk about documentation.
Yeah, because it's not just about the teaching itself.
Right.
We also have to document what we've done,
We do. It's important.
which can feel a little tedious sometimes.
I know it can. But think about it from a legal standpoint.
Yeah, okay.
We're responsible for showing that we've provided education
Right.
and that the patient is learning.
So good documentation protects us.
It does.
Yeah.
It also helps to ensure that care is consistent.
Okay. How so?
Well, imagine another nurse takes over your patient.
Right.
They can look at your notes
Yeah.
and see exactly what's been covered.
Okay, so it's like we're all on the same page.
Exactly. It's like passing the baton in a relay race.
I like that analogy. So what should we be sure to include in our documentation?
We want to paint a clear picture of what happened.
Okay.
So the learning need,
Yeah.
the goals you set with the patient,
Mm-hmm.
the methods you used, the content you covered,
Okay.
and most importantly, the patient's response.
How they showed they were learning.
Exactly. So instead of just writing patient education provided,
Right, which is super vague.
yeah, you want to be much more specific.
Okay, so give me an example.
Let's say you're teaching a patient how to use an inhaler.
Okay.
You might write, patient demonstrated correct technique for using a metered dose inhaler after verbal instruction and return demonstration.
Okay, so you're really spelling it out.
Exactly. What you taught, how you taught it, and how you know they learned it.
Got it. That
Uh-huh.
makes a lot more sense. Now, we've talked a lot about teaching, but counseling is also a big part of nursing.
It is.
So how is counseling different from teaching?
That's a good question. Teaching is really about giving information and skills,
Okay.
but counseling is more about helping patients cope and make decisions.
So it's more about guiding them.
Exactly, providing support and encouragement.
Okay. So when might a nurse need to use counseling skills?
Well, lots of situations.
Okay.
Like if a patient gets a difficult diagnosis,
Right.
you might help them process that news.
Yeah.
Or maybe they're struggling to make lifestyle changes.
Yeah.
You can help them set goals and find strategies.
So it's really about meeting them where they are emotionally.
It is. And helping them figure out their next steps.
Yeah. When I was a new nurse,
Yeah.
I was so focused on the technical stuff,
Yeah.
but I quickly learned that the emotional side is just as important.
It really is. We have to care for the whole person.
Absolutely. So the material I was looking at mentioned that counseling can be either formal or informal.
Right.
What's the difference?
Well, formal counseling is more structured.
Okay.
Like you might schedule a meeting
Yeah.
to talk about a specific issue.
Okay.
Informal counseling is more spontaneous.
So just those everyday interactions.
Yeah, like taking a few minutes to listen to a patient who's anxious.
Right. Or offering encouragement.
Exactly. It's about being present and attentive.
And those interpersonal skills are so important.
They're the foundation of good communication.
Now, just like with teaching,
Mm-hmm.
we need to tailor our counseling to each patient.
Absolutely. One size does not fit all.
I know when I was starting out,
Yeah.
I really wanted like a formula,
Uh-huh.
but it just doesn't work that way.
No, it doesn't. Every patient is unique.
Right. The material also mentioned different types of counseling that nurses do.
It did.
Can you talk about those a bit?
Sure. There's short-term counseling,
Okay.
which is for immediate problems.
Like helping someone manage anxiety during a hospital stay.
Exactly. And then there's long-term counseling.
Okay, for more chronic issues.
Right. Like if someone is diagnosed with diabetes,
Yeah.
they might need help adjusting to that.
Managing their condition.
Yeah.
Dealing with the emotional impact.
Exactly.
And there's motivational interviewing,
yes.
which is a specific technique
Right.
to help people change their behavior.
It's about exploring their motivation
Okay.
and overcoming ambivalence.
What if a patient needs more help than we can give?
That's when referrals come in.
Okay.
We have to know our limits.
Right.
And if a patient needs more specialized support,
Mm-hmm.
we can refer them to other professionals.
Like social workers or therapists.
Exactly. And referrals aren't just for mental health.
Right.
We might refer to support groups.
Yeah.
Or community resources.
Okay.
Whatever the patient needs.
So it's about taking a holistic view
It is.
and connecting them with the right support.
Yeah.
I think it's also important to talk about self-reflection
Oh, absolutely.
because we're always learning and growing as nurses
We are.
and taking the time to reflect
Mm-hmm.
on our experiences
Yeah.
can really help us improve.
It can. Both the good and the bad experiences.
Right, because every patient interaction is a learning opportunity.
It is.
And if we take the time to think about what went well,
Yeah.
what we could have done differently,
Mm-hmm.
we can become better nurses.
We can. It's like hitting the pause button
Yeah.
and processing what happened.
So it's an ongoing process.
It is. You know, one of the questions that really stuck with me from the material was this: are our patients better for having had us share in the responsibility of being part of their healthcare team?
Wow. That's a powerful question.
It is.
It really makes you think about the impact we have.
It does. Are we truly making a difference?
Are we empowering them
Yeah.
to take control of their health?
Exactly.
That's what it's all about.
It is. And self-reflection is key to answering that question, honestly.
And to keep growing.
Right. We have to be open to feedback
Yeah.
and constantly striving to improve.
This deep dive has really highlighted for me how holistic nursing is.
It has.
It's not just about tasks and procedures.
Right.
It's about building relationships,
Mm-hmm.
empowering our patients,
Yeah,
and making a real difference in their lives.
absolutely. So what's the one thing you want our listeners to take away from this?
I think it's to really embrace the roles of educator and counselor.
That's a great one.
Don't be afraid to ask questions.
Mm-hmm.
Learn alongside your patients. And make teaching and counseling part of every interaction.
Beautifully said. You know it's okay to not have all the answers.
Right.
That's part of the learning process. So don't hesitate to ask for help.
From your instructors or more experienced nurses.
Exactly. We're all in this together.
It's amazing how much goes into being a good teacher and counselor as a nurse.
It really is. And you know, one thing that stood out to me when I was reading about this
Mm-hmm.
is the power that nurses have
Yeah.
to empower their patients.
Because we're often there for them at really vulnerable times.
We are?
And we build these strong relationships
Yes,
based on trust.
absolutely.
It makes me think back to that story I shared
Oh, yeah.
about the patient who asked about Ray's syndrome.
Uh-huh. What happened after you researched it?
Well, we both learned a lot.
Good.
It turned out her grandchild had just gotten chicken pox.
Oh, okay.
and she was worried about giving him aspirin.
Oh, I see.
So by looking it up together, we were able to have a good conversation about the risks.
Right.
And she left feeling confident
Good.
that she could make safe choices for her grandson.
That's a perfect example of teaching and counseling working together.
Yeah, I felt really good about it.
Yeah. You know, it also brings up something else.
What's that?
The ethical side of things.
Oh, okay. Ethical considerations.
Yeah, because we have to remember
Mm-hmm.
that as nurses, we have a lot of influence.
Right.
Patients really trust us.
Yeah. They rely on our knowledge.
And that means we have to use that power responsibly.
So what are some of the ethical things we need to keep in mind?
Well, autonomy is huge.
Okay.
We always have to respect the patient's right to make their own choices.
Even if we don't agree with them.
Even if we don't agree,
Right.
we can give them information.
Yeah.
Help them understand the options.
But ultimately, it's their decision.
It is.
Okay, what else?
Beneficence is another big one.
Meaning acting in the patient's best interest.
Exactly. Everything we do should be aimed at helping them.
Okay.
And then there's non-maleficence.
Which means avoiding harm.
Right. We have to be careful not to put patients at risk.
Like if we're teaching them about a new medication, we need to make sure they know about potential side effects.
Absolutely. And how to take it safely.
Right. So it's a lot to think about.
It is. But it's important.
Yeah, it's about making sure our teaching and counseling is ethical.
Yes. As well as effective.
Well, this deep dive has given me so much to think about.
Me too.
As I move forward in my nursing journey.
Yeah.
It's really eye-opening to see all the different aspects
It is.
of providing holistic care.
And I think the biggest takeaway is that teaching and counseling aren't just extras.
Right.
They're essential parts of nursing.
And they can have such a huge impact on patients' lives.
Absolutely.
Right.
By embracing these roles,
Yeah.
we can help our patients take control of their health
Make good decisions.
and have better outcomes.
And it's a journey we're all on together.
It is, both us as nurses
Yeah.
and our patients.
Well, thank you so much for joining us for this deep dive into the world of teaching and counseling in nursing.
It's been a pleasure.
We hope you found it helpful and inspiring.
And as always, if you have any questions,
Please don't hesitate.
to reach out to your nursing faculty.
Until next time, happy learning, everyone.